What's going on? So, I'm here to talk about the VA. So the VA, man, I've been having, I've been getting my medical attention from the VA for a while, for years. After I got out in 2007, right? And so, I think it was like 4 or 5 months after I got out, 2007. I started. I applied for VA benefits, health benefits, and for the most part, that was, I mean, pretty much that's all my health benefits come from the VA. I never had no separate health insurance or anything like that. But the thing I want to talk about is the VA, man. I mean, they were so bad where sometimes it would take you about a year before you get an appointment. It's ridiculous, man. Now, this is how they used to work. You would have you would try to set up a VA health appointment with your healthcare physician. It might be 6 months, 8 months before you get a scheduled visit. But you could go in to do a walk-in. Now I don't know why they deal it like that. But you should just be able to go into a walk-in anyway. But you have to wait. Then a lot of times you have to wait to get like a CAT scan, or X-ray, or whatever, a specialized visit. Or you can do a walk-in, and with the walk-in is you really want to get there early because you're a walk-in. That means that they have other appointments set up, and they'll get to you when they can get to you. So you might be there 7, 8 hours before you get seen. Kind of like you're going to the emergency or something crazy. Don't go to the emergency at the VA. Boy, you'll be there all day sometimes. So that brings me to say that I need to get regular health insurance where I can see my doctor who don't have umpteen patients. Because what happens is the doctors, they try to rush you out. It's not really the doctor's fault, because it's the VA, to be honest with you. Because see, what happens is, and I know I'm all over the place, but I got a lot of information, a lot of things to get off my chest. What happens is they only have one major VA hospital in the state of Georgia, and that's in Atlanta. They have all these other little small hubs where people be coming from all over the state to go to the VA. Now, this is the problem with that. Sometimes they come and they don't have all the information they need. So they made a trip from Macon. They made a trip from Augusta. Some people come from Savannah. They make a trip from, all over Georgia. It may take them a couple of hours to get to Atlanta. And then they don't have the proper information. Now, it's not the VA fault they don't have proper information. Maybe, I don't know. Maybe somebody didn't tell them the correct information. Maybe they just didn't have the correct information. They didn't know, but they made that big long trip for nothing. Like if I didn't have information, I only live maybe 25 minutes away. So, man, I either had to come back that same day with the information, or I just come back the next day. But people who live way out, they can't just take 2 hours out their day to drive to the VA, come, see they don't have their information, then drive 2 hours back, then come back the next day and drive 2 hours, and then drive 2 hours. Man, that's just too much. They don't have enough VA facilities. Definitely not in the state of Georgia. The main VA facility where they need to get their care, it's just too far for them to go. It's ridiculous. They should have 4 major places. They should have 4 major places where people can go north, south, east, west. Right? That's really, excuse me, what they should have. Now that's another problem with the VA. So for me to have, excuse me, my own personal health physician outside the VA is very important, because see, what happens is those VA doctors, because they're seeing so many patients, they feel rushed. So if you really need to explain to your doctor what's wrong, because the thing about doctors are, they just listen to the patient. They listen to what the patient say their symptoms are. That's why they have to be good at asking questions to try to get down to what the problem is, because they're going off the patient. They go off the patient, and then they might do some blood work and try to find out what the problem is. But the real good doctors are the ones that ask the right questions. That's the right question. Then see, I didn't know that. Oh, so you have pain in both your left and your right side. But the person could say, I have pain. See what I'm saying? So they had to ask the right question. I have pain in my side. And then when look, a person could say, I have pain in my side, right? And then grab their right side. But they actually have pain in the right side. But maybe the right side hurts more or something. And then they just grab the right side. But if the doctor don't say, well, where else do you have pain? Oh, I have pain on my left side. Oh, you do. See, you have to ask the right questions. If you don't ask the right questions, then you ain't gonna necessarily get down to what the problem is. But if you rush, if the doctor's rush, he's not gonna take time. He or she is not gonna take time to ask the right question. So then the person doesn't get fixed, and it's messed up, man. Like, if I go to a mental health department inside the VA, they ask me the same exact question every single time. Let's say I have a session for 3 or 4 sessions scheduled. Then they ask me the same exact questions. Now, they only have 45 minutes to an hour to see you because they have other patients. So it's like, I want to get out to them of what's going on with me or whatever, but they keep asking the same questions. Like, dude, you asked me that last week. How you doing? How you feeling? Do you feel safe in your environment? It's like a script that they have to say. By the time they get finished with the script, 15, 30 minutes have gone by. And then when you really try to get down to the nitty gritty of what's going on, then they was like, well, let's stick on subject, or let's not talk about that so long. I'm like, dude, this is what I need to talk about. Like, why else am I here talking to you if you ain't listening to what I got to say? It's like you want to pick what I want, what you want me to talk about. That's not how it works. How you gonna pick what it is that I want to talk about? I'm telling you what's wrong with it. Everybody has different things that's wrong with them. It's not gonna be a generalized thing that's wrong with. So you got to listen to the patient. They don't want to talk about. Well, we don't want to continue talking about this. Let's talk about are you working out? Are you? What they got to do with me telling you what's going on in my head? Like, it's just crazy, man. And then, well, do you feel like you need another session? Yes, I feel like I need another session. But sometimes I'll say no. And the reason why I say no is because you keep asking me the same doggone questions, man. We ain't getting nowhere. It's like an orientation or something. It's stupid, man. Like, okay, check this out. I know it's a long video. I don't care. So, I went to a substance abuse class. I'm like, I gotta stop drinking. This was like years ago. So I gotta stop drinking, right? First of all, let me tell you something. When I went to this substance abuse, first of all, I went to go get information. I got to the place. Nobody was there to help me. It was one person. He was like, well, take this pamphlet and come back tomorrow. Dude, it's taking everything in me right now to come and ask for help. Then you're going to tell me to take this pamphlet and come back? All you had to, I mean, you don't have nothing else in place to help a person who wants help. I come to get help. Nobody's available. You give me a freaking pamphlet and say, come back. I ain't coming back. Do you not know how much it took for me to drive from my house to the VA to try to get help? Man, you talking about somebody with addiction? They trying to find out how they can get help, and then you gonna tell a dude to come, give him a pamphlet and come back? That makes me feel like you don't care. What kind of freaking substance abuse clinic is this? Did I come back? Nope, did not come back. Took me 6 months to a year to come back. And finally, I was given some information. I saw a psychiatrist at the initial orientation, or whatever you want to call it. Then I'm like, okay, cool. He sounds like he's gonna be able to help me out. So I went to this class. It was like an orientation class. It had a whole bunch of people in it. They were sitting around talking about their addiction. It was more than just alcohol. I thought it was just gonna be alcohol, but it was substance abuse. So they were talking about drugs and all that other stuff. So I was like, cool. Now one of the veterans was like, well, I thought this was gonna be a one-on-one session, but the person was like, no, we're gonna start off with the a group. So what happened was, he was like, okay, you want to come back? You can come back. I'm thinking like it's gonna be a continuation. Everybody's gonna be helping each other. When I come back the second time, it's like an orientation again. It's like the same thing is going on. They're going around, everybody talking about, I told you this last week. I told you this. This is the same thing. Everybody going around, it's like orientation. It's like you come to the classes for the first time. Then I went back a third time. Same thing. So so after the class, I'm like, okay, I thought it was supposed to be something that was going to be progressive, that we learn how to deal with certain things. It's like I hear the same thing over and over. So what he said was, they have these different classes that you can set up. You can set up. This is just orientation, basically. And once you think you're ready to have a specific class, a group that you can get with, then you can do that. I was like, cool, that's cool. Then I looked at the different classes that they have. They had stuff like how to maintain your weight, how to eat healthy, and these are the groups. I'm like, hold up, this ain't supposed to be substance abuse? What? None of these classes seems like they're dealing with substance abuse. What is this group? He said, well, these groups are designed for you. He gave me some type of explanation that didn't make no doggone sense to me. I'm like, this is supposed to be geared. All of this is supposed to be geared towards substance abuse. What does me eating healthy in a health group or some other group has to do with helping me with my addiction? And I'm like, this is not gonna work. It's stupid. We're supposed to be working on our health. No, how about working on substance abuse? It didn't make any sense to me. I'm like, this program sucked. So I had to have a specialized physician. And then you know what happened? You had to pay for that. Now, yeah, you don't really necessarily have to pay for a whole lot or anything for the VA, but if they giving you stuff it's not gonna help you, then what good is it? What good is it? And another thing I want to get off my chest. Once you get out of the military, you have, I think it's 3 to 6 months. I think it's 3 months to sign up for dental. And if you don't, then you lose it. You can't sign up for dental. Now, isn't dental not part of your health? If you can't keep your teeth right, don't that mess with the rest of your body? All you gotta do is look it up and read it. If you don't have good dental hygiene, it can mess with your heart and all this other good stuff. So what you trying to say? You trying to say that these veterans don't need dental? You can only get dental if you retired? That's ridiculous. And then you can only get dental if you sign up for 3 months, before 3 months, after you get out. Well, within 3 months you get out. After that, then you can't ever sign up for dental. It's ridiculous. It's the dumbest thing I ever heard of in my life. VA, man, they priorities is just messed up, man. They don't have enough. They don't have enough people, and they programs suck. That's all I gotta say, man. I'm pretty much over the VA. As soon as I can get some more health insurance, man, I'm doing that. I need specialized health care, because what they giving me right now is just like a band-aid, man. It's a band-aid. It's like whenever you get shot and they take you to the hospital, they might stop the bleeding and put a band-aid on you. That's what VA does. Instead of going in and getting the bullet and then stitching you up so you won't continue on bleeding internally. I mean, you can bleed internally or bleeding outwardly. The VA, they don't stop your bleeding. They don't stop your bleeding from the inside. They try to put a band-aid over, and then they trying to see the next patient. I'm tired of that, man. I need specialized health care.